So I had several operations, about 7 operations by the time I was 11, so I spent a lot of time in hospital as a child. When I was 10, 11, my mother was paralysed by a virus, something called Guillain-Barré syndrome. She was paralysed, she went blind, she couldn't breathe, she was ventilated for several months. When she began to recover, she had lots of physio, respiratory physio. She had to learn to use her diaphragm to breathe, to hold her head up, and ultimately to walk. And, you know, sometimes I was going along with her to her physio sessions, joining in a little bit. So that was a massive exposure to another facet of medicine I'd not seen. And my mother had this expression. She said, you know, the doctors saved my life, but the physios gave me my life back. Another expression I have is that medicine is great. Drugs and surgery have saved my life and hers, but there's more to medicine than drugs and surgery. I'm still astonished, really, in my journey and my exploration is to discover more about how much we can do. I took a job as a physiotherapy assistant for a year because I learned a lot about hospitals. I grew up a lot that year. I had a lot of exposure to physiotherapy and to just being in that environment in hospitals. Then went off to Bradford and studied physiotherapy. Absolutely loved it. I was very fortunate to be one of the few colleges in the country at the time, and still, where we had training in mental health, because many colleges don't. So I had undergraduate experience and then later postgraduate experience in working in acute and chronic mental health problems. That sort of spawned a bit of an interest for me in seeing how the so-called mind and body would work together. I was interested in neurology, not surprisingly, because of my mother. As I graduated, did further training, studied acupuncture and Chinese medicine, it became clear that musculoskeletal and outpatients work was what I was most interested in. Along the way, I've noticed patterns in patients. Like, why do so many people have irritable bowel syndrome and low back pain? Why do so many people, when you really question them, have neck problems that have also got thyroid problems or history of tonsillitis and things like that? And is that a coincidence? Well, I'm not a fan of coincidence. And when you've got patients where we pat ourselves on the back for the ones we help, but the ones really that I think we should be thinking about are the ones where we don't. I'm going, okay, so what is it that I don't know? What is it that I need to learn and understand? And the patient's never wrong. They can't be, because they're them. It's just up to us to figure out what's going on. And even if there are holding patterns as to why they're not getting better, well, okay, there's a reason. So what is that? Yeah, so with my mum, she had about 2 years of physiotherapy actively, and I think it took about 5 years really before she returned to the level of function that she did. She still has a little pins and needles in her hands and feet, but she's 89 now, and she continued teaching Keep Fit to over 50s until she was 70 years old. So she managed to make an amazing recovery, and she gives a lot of thanks to physiotherapists for that. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.